bacteria on the tooth surface. It can affect both children and adults, and if left untreated may eventually lead to pain, infection, and tooth loss. Causes. The tooth surface is coated by a thin film called plaque, which contains bacteria. Sugar from food debris on the teeth is digested by the bacteria, producing acid which demineralizes and softens areas on the tooth surface. Saliva usually counters this process by buffering the acid and providing minerals to help the tooth remineralize. If this balance is upset, the demineralized areas are slowly destroyed and caries spreads to the deeper, more sensitive layers of the tooth. Caries can also occur in the root surfaces, which are exposed due to receding gums. Once the inner pulp of the tooth is affected by caries, it becomes infected, and this infection can later spread to the surrounding bone and soft tissues if left untreated. Signs and symptoms. Initially, there is a patch of demineralization on the tooth surface, which may be discolored, and is often hidden within the tooth grooves or on surfaces between adjacent teeth. As the tooth structure is destroyed, a cavity is formed which may be felt or seen more easily. Once caries reaches the soft inner layer of the tooth, called the dentin, the tooth starts becoming sensitive, especially to hot and cold substances. With pulp exposure, the tooth becomes highly sensitive, with swelling and difficulty chewing on that side. Diagnosis. Your doctor will review your symptoms and conduct a complete oral examination. The carious lesion will be carefully examined and tooth sensitivity is assessed. An X-ray may be obtained to evaluate the extent of the caries. Treatment. Dental caries is primarily treated by drilling out the carious tooth structure and restoring it with an appropriate filling material such as composite resin or porcelain. If there is excessive destruction of tooth structure, a cap or crown may be constructed. If caries has spread to the dental pulp, a root canal procedure is indicated. Removal of the tooth is sometimes necessary for cases of severe caries. Dental caries is the process of tooth destruction that can effectively be controlled with proper oral hygiene and preventative techniques such as application of pit and fissure sealants, fluoride, and reducing sugar consumption. Early detection and treatment of caries preserves more tooth structure and is less complicated to treat. It is important to visit your dentist for regular exams and cleanings for the prevention of caries.